BlueSky Monitoring is a remote patient aligner monitoring system. This system allows you to track the patient's progress and receive photos and videos and compare them to the actual treatment plan for that particular stage side by side. The BlueSky Monitoring system is extremely economical. In some situations, we offer the scope, the patient app, and the clinical platform all completely free of charge. And in other situations, we charge a per patient, not monthly, but per patient cost of $29 per patient. In this training tutorial, I will demonstrate the different ways of initializing a new patient in BlueSky Monitoring and the relevant costs involved for each one. BlueSky Monitoring could be used to monitor the progress and receive photos and video scans from any patient wearing aligners from any system. The scopes could be printed in-house and the STL files can be downloaded free of charge, or the scopes can be purchased from BlueSky Bio starting at $13 per scope. Users who are using the AI-driven BlueSky Plan aligner flow can seamlessly transfer the data from the BlueSky Plan software to the BlueSky Monitoring platform, allowing for the side-by-side comparison between the planned data and the incoming scans from the patient. Dentists that are ordering premium aligners directly from LabPronto receive the entire package free of charge. The monitoring scope is shipped directly with the aligners, and the clinical backend as well as the patient app can be used for that patient completely at no charge. If you are using BlueSky Plan or any of the BlueSky Bio digital products, then you already have a BlueSky Monitoring account, and you can log in with the exact same credentials that you use to log in to BlueSky Plan, Bio Big Box, LabPronto, and the rest of our digital solutions. The first way to add a new patient to BlueSky Monitoring is directly from the BlueSky Monitoring dashboard. This will allow you to manage the patient, their timeline, and automatically request incoming scans and videos. We'll start with this technique even though it's not recommended. It's not recommended because it doesn't automatically transfer the data from the treatment plan into BlueSky Monitoring. While if you're using BlueSky Plan to plan your own cases, or if you're using LabPronto to order Pronto aligners, in both of those situations, the treatment planning data is transferred into BlueSky Monitoring, allowing that side-by-side comparison for each aligner step to compare the incoming photos and videos to the relevant digital 3D treatment plan at the particular step. So to get started, simply click Add Patient. Every user gets 5 free patients to get started with, and you can see the indication here that 5 out of 5 free patients remaining. We're going to click the Add Patient button and add the relevant information for the patient. Now, it is important to accurately add their email address as well as their phone number, as they will be receiving notifications and reminders as to when to perform the scans and when to change their aligners, and of course, any communication with their dentist. Enter the patient information and then click Next. A lot of the data here is automatically pre-populated. What's important is to take note of the start date. The start date is the date you will be delivering the aligners to your patient, and the entire schedule will be built based on that start date. So to modify, simply click on the field and select the correct start date. You will be able to edit and modify this information later, but of course it's better to enter the correct information as much as possible initially. If you are adding a patient who's already mid-treatment, then select the relevant start date as to when the patient started their aligner treatment. Now scrolling down, we have additional options. We have checkboxes, ask for fit rating on aligner change, meaning that the patient's going to be prompted to select options as to how their aligners feel and fit on the dates they're supposed to change their aligner, if it's too tight, if it's too loose, etc. Immediate trial patient education scan and fit rating is highly recommended. This will prompt the patient to do their first scan on their aligner treatment start date so they could do the scan with you in your office so that they understand the process and the process flow. Require dentist approval before aligner change. If you would like to receive the scans and receive the information and the patient only change to their next aligner when you approve, then go ahead and check this checkbox. Number of aligner sets is the total number of aligner sets, and aligner change frequency. We have weekly, bi-weekly, monthly, or custom, where you could enter a custom value. On the bottom, we have a drag and drop box. If you will be adding the 3D treatment planning files from a different planning software that's not BlueSky Plan, and you go ahead and drag it and drop it into the Dropbox to add the files. They do need to be in a particular format, which we could provide the relevant information. If you're using the BlueSky Plan software for in-house planning or the LabPronto system to order the manufactured aligners, then this data is automatically transferred. Go ahead and click on Next. On the last screen here, we have the scan schedule. This is pre-populated by default, but can be changed. First is when the scans should be done. So this is on the day of the aligner change. This should happen before the patient changes to their new aligner, and every second aligner change. So it's not on every aligner change, but it's on every second one. Here we have the type of scans, which is pre-populated by default, but again can be changed. By default, it's requesting a horizontal video scan with the patient's mouth closed with their current aligner, and as well as a horizontal video with the patient's mouth closed with their next aligner. So the patient, using the patient app and the scope, will be prompted to perform 2 video scans. They'll be taken through step by step with their existing aligner and their next aligners. Go ahead and click on Finish. And we can now see that the patient has been added to the system. And we could see their entire schedule, exactly when they should be changing their aligner, exactly when they should be doing scans, etc., etc. They'll be prompted via notifications and the app exactly what they should be doing when. When a scan comes in, you'll have a blue View Scan button that will show you the scans. And if a patient is overdue, instead of green for meaning everything's okay, you'll have red border around it. If it's pending your review, you'll have a blue border around it. And of course, you could filter accordingly. For dentists who are planning in-house using the BlueSky Plan software, transferring the data and activating the patient in BlueSky Monitoring is a streamlined process. On the export screen, simply click the checkbox to activate remote monitoring for this patient. Select the other relevant export options to export STL files and to create the report, and then click the export button. Select a folder or location on your computer to export the models, and then click the OK button. The models will first and foremost be saved to your computer, and then the relevant data will be transferred to the BlueSky monitoring system, and the patient details and the scan details can be reviewed. From within the BlueSky Plan software, you'll be prompted to enter and confirm the patient's details. Pay special attention to their email and their phone number and its accuracy, as they will be receiving updates and notifications via their email and cell phone number as to when to switch their aligners and to perform the relevant scans. Go ahead and click on Next. And here we could see that we have significant information regarding the treatment. Most importantly is the aligner start date. This is the date you will be giving the patient their aligners, so please update accordingly. We have additional options to ask for a fit rating on aligner change if you would like the patient's feedback about how the aligner fits, if it's tight, if it's loose, if it's comfortable, uncomfortable. Immediate trial patient scan and fit rating, which we highly recommend. This will send a scan request to the patient on the aligner start date, so they could do the first scan and go through the process with you in your office. Require dentist's approval before aligner change means that if you would like to see the scans and have the aligner changed to the next aligner only after you approve and they receive a notification through the app that you approved, then check this checkbox. All the relevant files from BlueSky Plan have been attached automatically, and we could see them here. There's no need to do anything with that. The number of aligner steps and the aligner change frequency have been added automatically as well. So just review and confirm, and then go ahead and click on Next. And the last step is to review the scan schedule. So this is pre-populated with their default, meaning that on the day of the aligner change, before they change their aligner, they should be prompted to do a scan, not with every aligner change, but every second time they change their aligner. Now, all these fields, you could go ahead and update accordingly. The type of scans that they're going to be doing a horizontal video scan with their mouth closed with their current aligners, and then they'll be prompted to do a second scan, again with their mouth closed, a horizontal video with their next aligners. Now, of course, once they complete the scan, you will receive a notification, and you could review the scans in the clinical monitoring dashboard. Once you've confirmed this step, go ahead and click on Finish. The relevant files are being uploaded, so keep the screen open and allow it to process. You will receive a notification once all the files have been uploaded successfully. Okay, now we receive notification the patient has been activated successfully in BlueSky Monitoring, and we could see the patient in the clinical dashboard. Once the patient sends in scans, we'll be able to see a side-by-side comparison between the 3D view showing us the teeth positioning at the particular aligner step next to the video from the patient scan. Weathering your aligners through LabPronto is the fastest, most efficient, and cheapest way to have your aligners manufactured. In addition, your patient will be activated in BlueSky Monitoring. You will receive the monitoring scope with the aligners for the patient, and the patient, together with the scope in the clinical backend, is completely free of charge. It is an add-on bonus when ordering aligners through Pronto Aligners. Click the Order Now button, complete the prescription form for your aligner order, and make sure to check the checkbox Activate BlueSkyMonitoring.com upon case completion free. Then proceed to complete the prescription form and place your order. Your aligner case will be shipped to you with the BlueSky Monitoring scope, and you will receive an email that the patient has been activated on BlueSky Monitoring. Click the button, open BlueSkyMonitoring.com. Review and confirm the patient's information, and then click Next. Review and confirm the pre-populated fields, paying special attention to the start date, which is the date the patient will be receiving their aligners. There are additional options to ask for fit rating on aligner change, which will prompt the app to ask the patient how the aligners feel, if they're tight, if they're loose, if they're comfortable, if they're uncomfortable. We have the option, which we highly recommend, for an immediate trial patient education scan, which means that they will receive their first scan request on their start date, so it could be done in your office. They could become familiar with the process. And we have required dentist approval before aligner change, which you should check if you would like to review the scans and have the patient change their aligners only after you have given your approval. Confirm the number of aligner sets and the aligner change frequency, and the relevant 3D data is automatically included. Finally, review the scan schedule, which is when the scan should happen. By default, it's set to the day of the aligner change, before the aligner change, and every second aligner change, which means the patient will be prompted to perform the scan on the day they're scheduled to change their aligner before they actually change it. And it's not every aligner change, it's every second aligner change. The default scans is a video horizontal scan with their mouth closed, wearing their current aligner, and they'll be prompted to perform a second scan as well, horizontal video, again with their mouth closed, with the next aligner. Click Finish to activate the patient in BlueSky Monitoring.